Head and neck cancer is an oncological disease. Look at this picture, shows that head and neck CT scan findings and MRI findings. Look at this. A detail going on. Introduction. Head and neck cancer encompasses a group of malignancies that arise in the oral cavity, pharynx, larynx, sinuses, nasal cavity or salivary glands. It is one of the most prevalent cancer worldwide, especially in regions with high tobacco and alcohol use. Early detection and multidisciplinary management are key to improving outcomes. Definition. Head and neck cancer refers to a group of malignancies affecting the oral cavity, pharynx, larynx, sinuses, nasal cavity and salivary glands, often linked to tobacco, alcohol and HPV infection. Early detection and a multidisciplinary approach to treatment are crucial to improving survival and preserving quality of life. Types. 1. Oral cavity cancer includes cancers of the lips, tongue, gums and the floor of the mouth. 2. Pharyngeal cancer divided into nasopharyngeal and oropharyngeal and hypopharyngeal cancers. 3. Laryngeal cancer involves the voice box. 4. Paranasal sinus and nasal cavity cancer. 5. Salivary gland cancer. 6. Thyroid cancer, considered by some as part of head and neck cancers. Causes. 1. Tobacco use. Smoking and chewing tobacco are the leading two causes. 2. Alcohol consumption. Acid. Synergically with tobacco. 3. Human papilloma virus HPV, especially linked to oropharyngeal cancers. 4. Epstein-Barr virus EBV associated with nasopharyngeal carcinoma. 5. Occupational exposure to dust, chemical and asbestos. 6. Genetic predisposition. 7. Radiation exposure. Ionizing radiation to the head and neck. Risk factors. 1. Lifestyle factors, tobacco and alcohol use. 2. Dietary factors, lack of fruits and vegetables. 3. Gender, more common in males. 4. Age, typically affects individuals over 50. 5. HBV infection, increasing incidence in younger populations. 6. Immune suppression, HIV, AIDS or post transplant. 7. Poor oral hygiene. Complications. 1. Metastasis to lymph nodes, lung, liver and bones. 2. Functional impairment, speech, swallowing and breathing difficulties. 3. Recurrence, high rates if untreated or inadequately treated. 4. Secondary infections due to immune compromise or post-surgery. 5. Disfigurement, post-surgical or due to tumor progression. Pathophysiology begins with mutations in the epithelial cells, often driven by carcinogens. Progression involves uncontrolled cell growth, inversion of local tissues, angiogenesis and metastasis. In HBV related to cancers, viral oncoproteins E6 and E7 inactivate tumor suppressor proteins P53 and RB. The development of head and neck cancer involves the sequence of biological changes triggered by genetic mutations and environmental factors. Below is the step-by-step process. 1. Initiation, genetic and environmental triggers. Carcinogenic exposure, genetic mutations, tumor suppressor genes. 2. Dysplasia, abnormal cellular changes, epithelial dysplasia, loss of control mechanisms. Apoptosis inhibition, cell cycle dysregulation. 3. Carcinoma in sight, localized malignancy. Cell exhibit features like increased nuclear to cytoplasmic ratio, loss of differentiation, increased mitotic activity. 4. Inversion, breakdown of basement membrane. 5. Angiogenesis, blood supply formation. 6. Immune evasion, escaping immune surveillance. 7. Metastasis, spread to distant sites. 8. Tumor microenvironment, sustained progression. Secretion of cytokines and growth factors promotes tumor expansion and immune suppression. By following these steps, head and neck cancers progresses. from localized epithelial changes to invasive and metastatic disease, emphasizing the need for early intervention to halt this progression. Signs and symptoms. A. General symptoms. 1. Unexplained weight loss. 2. Persistent fatigue. B. Localized symptoms. 1. Lymph in the neck. 2. Non-healing ulcers or sores. 3. Difficulty swallowing, dysphagia. 4. Hoarseness or voice changes. 5. Persistent sore throat. 6. Ear pain or hearing loss, a nasopharyngeal cancer. 7. Nasal obstruction or bleeding. Diagnosis. A. History and physical examination. Assess risk factors, symptoms and physical abnormalities. B. Imaging studies. CT scan, MRI, PET scan. C. Endoscopy. Direct visualization of lesions. D. Biopsy. Difficulty diagnosing through histopathological examination. E. Molecular tests, HPV or EBV status testing. Nursing diagnosis. 1. Impaired swallowing related to tumor obstruction. 2. Anxiety related to cancer diagnosis and prognosis. 3. Ineffective airway clearance related to tumor growth. 4. Risk for infection related to treatment. Induced immune suppression. Management. First, medical management. 1. Surgery, tumor resection, lymph node dissection. 2. Radiation therapy, external beam or brachytherapy. 3. Chemotherapy, cisplatin. 4. Targeted therapy, EGFR inhibitors. 5. Immunotherapy, pembrolizumab for advanced cases. Nursing management. 1. Airway management, suctioning, tracheostomy care. 2. Nutritional support, internal feeding if swallowing is impaired. 3. Pain management, administer analgesics and monitor for side effects. 4. Psychosocial support, counseling and support groups. 5. Rehabilitation, speech therapy for post-treatment functional recovery. Treatment options. 1. Multimodal approach, combining surgery, chemotherapy and radiotherapy. 2. HPV related cancers often treat with de-escalated radiation and chemotherapy to minimize side effects. 3. Palliative care for advanced cases, focusing on symptom relief and quality of life. Psychosocial medicine, 1. Emotional support, managing anxiety, depression, and body image issues. 2. Social support, encouraging family involvement and peer support groups. 3. Financial guidance, assistance with treatment cost and insurance. Prevention, 1. Lifestyle modifications, quiet smoking and alcohol consumption, safe sexual practices to reduce HPV risk. 2. Vaccination, HPV vaccine for prevention of related cancers. 3. Regular screening for high risk individuals. In conclusion, head and neck cancer is a multifactorial disease with significant implications for physical and emotional health, early detection and personalized treatment, and a holistic care approach improve survival rates and quality of life. Public health measures focusing on prevention and awareness are essential to reduce the global burden of this disease. Thank you. Have a nice day.